Across Africa, health systems are being asked to do more with less. External health assistance is shrinking. Debt and debt servicing is squeezing national budget. Disease threats are rising, as been shown by the various outbreaks on the African continent. And families face the cost of care when the system cannot fully protect them. So the question is no longer theoretical when we ask that when the aid runs out, who will build Africa's health systems? Welcome to another episode of the ACRN Health Podcast. Today I'm joined by Honorable Modou Lamin B, who is Chairperson of NEAPACO, the Network of African Parliamentary Committees of Health, and he's also the Vice Chairperson of the Health Committee in the Parliament of The Gambia. Welcome to another episode of the ACRN Health Podcast. I'm your host, Wilfred Gurupura, and today is a special one because we're discussing an issue which is very topical, and we're talking to someone very, very important. Today I'm joined by the Honorable Modou Lamin B, who is the Chairperson of NEAPACO, which is the Network of African Parliamentary Committees of Health. He is also the Vice Chairperson of the Health Committee in the Parliament of the Gambia. We'll talk a little bit more about NEAPACO, but this conversation, we really want to talk about money. We've got the Honorable, we want to talk about power, accountability, medicines, research, communities, and really about whether Africa can turn health sovereignty from a slogan into a system. So welcome, Honorable, and thank you for joining me.
Thank you very much, Dr. Wilfred. I am indeed very honored to be here today on this important podcast to talk about issues surrounding health in Africa. And by the way, as you rightly introduced me, I am Honorable Modou Lamin B, a member of Parliament from the Republic of the Gambia, and also the Vice Chairperson of the Select Committee of Health. And again, I also serve as the Chairperson of the Network of African Parliamentary Committees of Health, that is NEAPACO. And again, I am indeed very honored to be on this important podcast.
Thank you so much, Honorable. I want you to take us a little bit into the Gambia. I was telling you earlier that I visited the Gambia, a very beautiful country. And so my first question for you is, what's a health issue that you've heard from citizens in the Gambia that has really stayed with you and has really struck you?
Thank you very much, Doctor. I believe this is indeed a very important question, and I will start from my very own constituency, Banjul North, and go beyond. The issue that stays with me is when a mother tells me she walked 3 hours to a health center only to be told that the hypertension or diabetes medicine is out of stock. That moment policy becomes personal. It is not about papers, it is about cost, access, and trust. That is why I led NEAPACO, because the laws and budgets we pass in Parliament determine whether that medicine is on the shelves.
So Honorable, you are on the Health Committee. How are you dealing with the issue that you've just raised about lack of access to medicines and other things? What have you done so far within your committee?
We've done a lot, especially when I came to Parliament in year 2022. We've seen a significant improvement when it comes to the budget allocation when it comes to drugs in the Gambia. And I can tell you that year in, year out, since 2022, my committee have been working tirelessly in collaboration with the entire Parliament to see how best we can increase the budget that has to do with drugs as far as the health budget is concerned. Understanding also that part of our mandate is to appropriate. We are responsible for the budget appropriation. So the advocacy we've been doing have been very successful, and year in, year out, since 2022, we have seen a very significant increase when it comes to the allocation of drugs as far as our national budget is concerned in the Gambia.
Okay. Interesting. So I want to take you out, Honorable, out of the Gambia for a little bit, and I want you to talk a little bit about NIAPACO. What is it? Who is it comprised of? And how does it concern, people who are not parliamentarians?
Another good question. NIAPACO, that is the Network of African Parliamentary Committees of Health. We are parliamentarians from across Africa who sit on health committees. We are not clinicians, but we hold the power of the pulse, laws, budgets, oversight. Without us, policies from ministries and technician agencies never get funded or implemented. Researchers and manufacturers should care because we decide the enabling environment by making sure that there are regulations, by making sure that there are availability of financing, and also the procurement laws. This is NIAPACO in short.
What wonderful. So for people like us who are in research or regulators or manufacturers of drugs, why should they pay attention to this grouping of parliamentarians called NIAPACO?
Yeah, because like I said, we have the power of the purse. That is why we have the powers to make laws. We also have the powers to appropriate budget, the funds, that is through the budget sessions in our different parliaments in Africa, and also to perform oversight over to the executives of our different countries. So meaning we are the apex authority in our different countries that is given the powers by our constitutions to perform oversight to all government institutions, including the presidents, the office of the presidents. So it is very important to know that this network also is the biggest parliamentary health network in the continent.
Okay. We're told that there was a recent conference for NIAPACO in Zambia, Lusaka, and this conference happened at a time where there's less money coming in for aid onto the continent. There's more debt. There's more disease threats. For example, there's an Ebola outbreak at the moment, and things like universal health coverage are still unfinished. So I want you to take us a little bit into that conference in Lusaka. What did it feel like, and what were you talking about? What was the sense like at your conference in Zambia?
The conference in Zambia was a different one, and I can say the room felt different. There was urgency, not just presentations. The feeling was it is no longer guaranteed. So we talked honestly about debt, domestic resource mobilization, and stopping the cycle of waiting for donors. Lusaka felt like a turning point because we stopped asking who will save us and started asking how do we save ourselves. So this was the message in Lusaka.
Okay, interesting questions, Honorable. What were the answers?
The answers were very interesting because in every meeting that we have, in every annual meeting that we have, and the Lusaka meeting was the 17th annual meeting by the NIAPACO, organized by NIAPACO. So what we normally do is that all countries present will make commitments and also report on the previous commitment, that is the previous year the commitment that they made. So it is always in a form of in a form of making presentation for other countries to learn what we have committed this year and what we have accomplished during this year, so that it will be reported for next year. So that is how it is normally done. But like I said, it was a turning point, to be honest. And at the end of the day, with the Lusaka meeting, we really felt like it was a turning point, because we stopped asking who will save us, because that's the honest truth, and we started asking how do we save ourselves, because that was the honest conversation that we could have put on the table to see how best we can resolve our current situation as Africans and also as lawmakers in Africa.
Wonderful. So Honorable, how did you actually manage to do it with all these parliamentarians in the room? Because normally what we see on TV is parliamentarians not getting along, arguing and fighting, each one wanting their own view to be heard. You're the chairperson of this conference. How did you manage those dynamics for this meeting?
Okay, I was elected during this meeting through that is after the meeting we had an AGM. So by then I was not the one in charge of the leadership as far as the conference was concerned, or the meeting in Lusaka. But again, I participated fully, being a very proactive member as far as the network of African Parliamentary Committees of Health is concerned. It was indeed a very important meeting that we had, because looking at the current situation when it comes to health issues in Africa, the issue of funding, to be more specific, it is something that we must prioritize. And understanding that as lawmakers, we are the ones given the powers to appropriate during our budget sessions, especially as declared by the Abuja Declaration that talks about the 15% of the budget, that is a national budget, should be allocated to health. It is something that we also started realizing, even though we are not fulfilling that particular declaration yet as Africans. But I believe as we go along, we are significantly working towards that, because we have seen African countries, even like Zimbabwe, doing extremely well in terms of making sure that they adhere to the agreement that was declared in Abuja. So it is already 25 years, if my memory serves right. But again, I believe it is also very important, as our target is 2030, and 2030 is just few years from now. So meaning we have to accelerate our efforts as members of parliament, as a continent, to see how best we can focus and also add more resources when it comes to our allocation for health in Africa.
Okay. So Honorable, I want to take you back to what you're saying, where the commitments were made at this conference in Lusaka. And you've just said, there's commitments that were made before in Abuja, which have not yet been, which have not yet come to pass, have not been operationalized. So for me, who's not a parliamentarian, why would I believe that this time things will be different, that the commitments you made in Lusaka will actually be done? Talk me through how you believe things will be different this time.
Yes, I will take you through 2025 Darussalam that was in Tanzania, the commitment we had delivered. And I can give you an example. Several countries tabled increased domestic health budget allocation in their 2025-2026 budgets, and referenced NEPACO advocacy. This is one fundamental thing. Also, one slower, that is when it comes to the tracking and publishing disaggregated data on non-communicable diseases and also sexual and reproductive health rights, and data systems are still weak, which is also another reality that we are facing. So now, in that regards, budget execution gaps, big data, and lack of citizen pressure after the meeting ends is a very big challenge. That we think that is one of the ways that we must get out of as a continent. So in order to avoid such a thing, another document that is Lusaka agreed on a results tracking mechanism. Additionally, peer accountability. This is the mechanisms that we put in place. So we will report back country by country, which is indeed very important. Just last week, we saw countries from East Africa and also South Africa met in Uganda to have a meeting, concerning the mechanism that we put in place in terms of our monitoring mechanism towards tracking what we do as countries, because it is very 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 fundamental to hold members of parliament and also parliaments accountable in terms of how they do things and why they do it. And you can only do this by making sure that you put a very good tracking mechanism that you can use to get what you and what we have is the real framework, and the real framework is indeed something that we use in making sure that we monitor and also track whatever countries are doing, especially within the continent, towards health.
Okay. Honorable, since I have you, you are parliamentarian, you are chair of these various committees in NEPACO. I want you to take us behind the scenes and give us a sense of what gets in the way of the progress of these commitments after the meetings. Is it the politics? Is it the money? Is it bureaucracy? What goes on behind the scenes that gets in the way? Just tell us.
So many things go behind the way, but I will bring in the issues surrounding sovereignty, because this is very fundamental. And when I say sovereignty means making hard budget choices. It means choosing to put on primary health care and also prevention, even when it is not visible. It means a woman in the Gambia getting her antenatal care without paying out of pocket. It doesn't mean isolation. We still need partners, but we must lead the agenda, because these are things that normally happen behind the scenes. But at the end of the day, it is always very important as members of parliament to prioritize the issue of ownership, the issue of being in front. See to it that we lead as far as the agenda of solving healthcare services in the continent is concerned.
Wonderful. But Honorable, sometimes when we hear big words like health sovereignty coming from parliamentarians, it's more like, something like a slogan. In practical terms, I'm this mother who wants to access her medicines. Can you break down practically what it would mean for ordinary people in the Gambia, in Nigeria, in Zimbabwe? What does health sovereignty mean practically?
Yes, I mentioned it earlier on. I said it means choosing to fund primary health care and prevention, even when it is not visible, because this is something that we must try by all means to make sure that it happens. And I gave a typical example. For example, in the Gambia, getting a woman in the Gambia getting her antenatal care without paying out of pocket is something that we advocate for. And it doesn't mean that it's like isolation, but we still need partners, because at the end of the day, whatever we do as far as healthcare services are concerned in Africa, we still need the partners. But again, we must lead the agenda, and I think that is very clear. But like you said, as members of parliament, what are we really doing? Because it's very fundamental to talk about what we are doing. What we are doing is trying by all means to increase the advocacy, to create more awareness, to widen the horizons of our comrade parliament, and again convince them to make the right choices by making sure that appropriations are adequate. They are fit for purpose. Whatever we appropriate towards our primary health cares, services, and also antenatal care should fit for purpose. Because at the end of the day, if we under budget, that will be another problem. That is when we will start inviting partners, and partners, instead of us leading, they will come and lead. And that should not be the case, because it is our problem. And I believe as an individual, and understanding that my problem, I don't think nobody can solve it better than myself, because I already know my problem. So in solving my problem, if I am to invite anyone outside, it's just a matter of bringing in that person or that individual to see how best we can collaborate. But no matter what, I must take the lead in solving that particular problem, because it is my problem. So this is very fundamental in terms of what we do. And yeah.
I totally agree with you there, Honorable. I just have this sense that, and I want to get your thinking on how do we balance then the competing priorities in our countries and our continent. So we've spoken about declining external funding. We want to maintain our health sovereignty, but sometimes we just don't have enough resources to finance primary health care. So in your mind, how do we then balance all these competing priorities?
Okay, understanding your question is like who pays the universal health coverage now? And I can say that we do. And we do through domestic resources, smarter spending, and reducing waste. Parliamentarians must protect health in budget debates, even when debt is high. Key questions we must ask: what percentage goes to prevention, which is very fundamental? What is the out-of-pocket burden? Are we funding salaries but not medicines? One political budget choice, we can say sin taxes on tobacco or sugar to fund health, because this is very fundamental in what we do. Because at the end of the day, I believe we are the very people that pays for the universal health coverage now.
So you said something interesting there, Honorable, about sin taxes for tobacco.
Yes.
I would think is that more political than technical? Because I would think that's much more technical.
That one is a political budget choice.
Really?
That is what I meant. Yeah, it's a political budget choice. Yeah. A parliament or a particular country can just decide that, yes, look, let's sin taxes on tobacco and sugar to fund health, and we can do that. For example, if we charge more taxes on tobacco and reallocate it to those funds to health and finance that. Because we have seen the damages that tobacco is doing in Africa.
Yes, we have.
And it's rather unfortunate with the engagements that we had with experts. The amount of money that we are spending in terms of getting access to tobacco, and how much we are spending for treatment. the gap is very huge.
It's very big.
Understanding those dynamics, I believe it is high time as Africans, as parliaments in Africa, to see that we put this one political budget choice in place.
Okay.
Yeah, and I believe so many parliamentarians that are really concerned about health funding or health financing will agree with me on that.
Okay. So I want to follow on that, Honorable, to say, as ordinary people in the different countries in Africa, do you think we are really ready to have honest conversations about how much health really costs and how we should fund it?
Of course, I believe so. I believe so. So that is why NEPACO is taking up the initiative to create that platform for members of parliament to meet together and have this discussion towards how best we can resolve the question that you just asked, because knowing the cost also is very key, because like the saying goes, if you know a problem, it is half solved.
Okay. Yes.
You understand? So
Yes.
putting more efforts towards solving it will automatically bring it to an end as far as the solution is concerned. So it's very important. I think with the Gambian context, what we do is we try by all means to engage. I think that the word that I will prefer using here, consistent engagement in terms of making sure that there is constant engagement in whatever we do, especially when it comes to health financing. Is very, very important.
That is so encouraging to hear. And I want to follow that up by saying, you're as chair of NEPACO, how exactly does NEPACO bring citizen voices and patient voices into the rooms where you are having discussions? I mean, on a practical basis, how do you do that?
Yeah, we do that through inclusion initiative by making sure that everybody is in. And when I say everybody, I mean all parliaments in Africa have the right to be part of the network. But again, I can say that we can say something is missing. And like the saying goes, who is missing from the room? It's very important. For me, what I understand when I say who is missing from the room, I refer it to the citizens, that the people that we serve. I also refer it to the community health workers. I also refer to women, adolescents. But again, NEPACO must take hearings to the community. This is our sole responsibility. On sexual reproductive health rights and maternal health, we cannot let financing debates crowd out people's realities. Because at the end of the day, let's say, for example, on North Africa and Francophone inclusion, we are not actively following up. A network is only as strong as its representation. This is what I do. Because no matter what, if everybody comes together with their different, case studies, with their different achievements towards what they have done to improve healthcare services in their different countries, other countries will also learn from them, and they can improve. So this is very fundamental. But the missing part, as far as the room is concerned, to be honest, are the citizens, the community health workers, and also the women and adolescents. It is really missing as far as our community outreach or hearings are concerned, to be honest.
Okay, so given that we know who is missing in the room, in your view, what can we do to make sure that these people are not missed in the rooms going forward?
Yeah, that is why I said NEPACO must take hearings to the communities. And one of the ways that they can do is on this SRHR, that is this sexual reproductive health rights, and also maternal health. because we need to understand that we cannot let financing debates crowd out people's realities, because
Yeah.
these are the people on the ground, on as far as the grassroots is concerned. So
Yes.
these are the people that we represent, and understanding
Yes.
that we are the people's representative is important to reach out to them to better
Yes.
understand what is really happening, so that we can take care of those, because like the saying goes, a problem that is not solved is still a problem, but a problem that is solved is no more a problem. So eventually you cannot talk about the problem when you don't know what is the problem.
What is the...
And the only way you can know the problem is to reach out. Make sure that you take the hearings, to the communities. Talk to them.
Okay.
And know exactly what is going on. So from there, you will be able to make informed decisions that will be able to address health issues in your different communities in Africa.
Okay. So Honorable, there is an issue that has come up in our recent conversations on this podcast, which is related to what you said about health sovereignty on the continent. And specifically, that is about pharmaceutical sovereignty and African countries making their own medicines. So from what you know and what you've been discussing in your committees and in your PACO, what must be true for us as Africans to be able to make our own medicines? I want to hear your perspective as a parliamentarian.
Thank you once again, Doctor. I believe what we first have to establish is that manufacturing without regulation is dangerous. This is very fundamental.
Wait. Please say that again. Say that again.
I said what we need to put in place before we move forward as far as this particular question is concerned is that manufacturing without regulation is dangerous.
Powerful. I like that statement. I'm going to quote you.
And what is very fundamental here is that we need African Medicines Agency ratification and also strong regulatory authorities and research capacity track like any other health indicator in Africa. We must also trust in Made in Africa. This is very fundamental. Made in Africa medicine starts with data and quality systems. Parliament's role, we know, is to pass the laws and fund the agencies. So this is something that I believe is very fundamental that we must understand as far as pharmaceutical is concerned, with evidence as far as our backbone is concerned in Africa when it comes to pharmacy. Yeah,
I like that. But Honorable, the reality is we are so different, or we could say we're different in Africa in terms of where we are on this journey to sovereignty. How then do we balance out these differences so that as a continent, jointly we achieve the ability to make the drugs ourselves?
Yeah, that's where the issue of the trust comes in. The trust in Made in African medicines start with data and quality system. If we have our own, if we trust each other and understand that Made in Africa medicines starts with data and quality systems, we are good to go. Because as parliamentarians, our roles are very simple when it comes to this. To be honest, they are very, very simple. And our role is to pass the laws and fund the agencies. And I think that shouldn't be the problem for parliamentarians in Africa. Because as long as we don't have the trust, we cannot achieve this, to be honest. And like you said, we must collaborate. We must come together as Africa, as one Africa, united Africa, with one united force to see to it that we make sure that that required regulations are put in place through laws, and make sure that all what is needed in terms of financing is being appropriated by the parliaments in Africa. That's all. But one key message is the trust.
Yes.
Go
ahead, Honorable.
Yes, I said one key message is the trust. And the trust is Made in African medicines.
Yes.
And going forward, this starts with the data and quality system that we put in place.
That we put in place.
Yeah.
So what do you do as chair of NEOPACO, and how does NEOPACO kind of engender this trust in everything African, including the medicines? But what can you do as NEOPACO and as the chair of NEOPACO now?
Yes, Doctor, I said it before. All what I can do, and also as a network, NEPACO, we need the African Medicine Agency ratification, and also strong regulatory authorities, which is indeed very important. And going further, we also need research capacity tracked like any other health indicator. Because all these things are tools that we can put in place in order to achieve this particular trust that we believe we can have as far as made in African medicines are concerned.
Okay. I bring this up, Honorable, just to make sure that myself and our viewers and listeners are clear that NEOPACO can become self-reliant, because we want to kind of understand how NEOPACO is going to function, how it's going to finance itself, so that it's actually able to achieve the grand vision. So walk us a little bit about tell us a little bit about that side of things for NEOPACO. What is the future looking like? What do you think as chair should happen in terms of financing and to ensure that it can achieve what it intends to?
I am so glad to respond to this important question, because when it comes to self-reliance test is very, very fundamental. And Lusaka has been a very good example as far as NEPACO is concerned. But I will start by saying that Lusaka was partly funded by member subscription, which was a good start for us, understanding the commitment that we have towards making sure that we are self-reliant. That is symbolic, I can say.
Okay.
But again, if we ask countries to be self-reliant, NEPACO must model it, which is very, very true. And how do we intend to do that is to institutional departments requires predictable internal financing, which is very important. And we are exploring that now, because currently, as I am speaking to you, NEPACO is working on 3 agenda points for the next 12 months. As suggested, and one has to do with budget tracking, because it's very important for us to track the budget, and we are trying to see how best we can get at least 20 member countries to publish health budget execution versus allocation. This is one fundamental model that we to put in place, and that is why the real framework comes in terms of monitoring what health committees and also what parliaments are doing in terms of health in different countries in Africa. So the second one have to do with legislative action, which is also one of our core mandates. We're thinking of supporting at least 5 countries to domesticate the Africa Medicines Agency and also the universal health laws, because it's very, very important. The universal health coverage laws are very, very fundamental. And the third one is citizen accountability.
Okay.
So again, we must be accounted by that. So in that regard, we want to file a constitutional dialogue NEPACO reporting. It's also very important. Those are the 3 fundamental agenda that we really want to work on to see to it we at least achieve what we call and as far as NEPACO is concerned.
Okay. Honorable and as chair, where is the next conference and can I come?
Of course, you are highly invited. The next conference is going to be in Kenya, Nairobi, I believe, and we're going to be in the month of February next year. It's going to be the 18th annual meeting organized by NUPAC in collaboration with the Kenyan.
Okay. So you've got maybe about 6 months left to the next conference.
Yes.
How are those 3 commitments looking? Do you think you'll be on target? Dear listener, our sincere apologies for the sound quality. When we did the recording, the Honorable Lamin was in the field, so you may experience and hear some distortions with the sound. Our sincere apologies once again.
We hope so, because we are not also making it very difficult to member countries, because at the end of the day, all what we did today is to support them. And our secretariat in Uganda, under the leadership of Mr. Patrick, they're doing extremely to read that, like I told you earlier on, just last week, countries from eastern part of Africa and also southern part of Africa gathered in Uganda to have a training, a meeting on the real thing. So this story you that we are more than committed to achieve this particular agenda, and to see to it that the next committee in Kenya will be a meeting of a difference. As you can see, I am person. We are also trying make sure that the issue of young people is being manifested globally, not only continentally, but globally. But again, with desired trajectory and dynamics in making sure that we make things work for Africa.
Yes.
It's very, very important. Because there is a saying that when you lose your health, you lose something.
Yeah.
So it is very fundamental. Understanding also that you cannot harness the market without enhancing or putting in place the proper healthcare mechanism. And we all know that it's peacefully populated, and this is already a window that is existing. It's very open, but the target is here until 2050, which is about 24 years to come. That window will close because age in terms of our people with more than 5 years old, they will be more than the young people.
Yes.
So what are we doing? Yeah, that's okay. So that is why it's very important to put all these things in, even if we don't benefit our future years.
Yeah. No, this has been wonderful talking to you, Honorable. My last question to you would be, what message do you want to leave us with as, fellow citizens of Africa? Any final messages?
Yes, of course. I do have final message for my fellow Africans, especially us, the young African. Yes, this is the moment Africa stops outsourcing its health teacher. To every young leader, your voice, your data, your advocacy matter. Parliament is listening, but we need you in the room. This is my message to the African.
Well, wonderful, powerful. I'm leaving this conversation encouraged. I'm leaving it energized. I can see why you're in Parliament.
Thank you.
So no, it's been a real pleasure to host you and have you on our podcast, Honorable. I hope you can make some time later to come back again and we can follow up on some conversations. But it's been a real honor and a real pleasure. And we're really behind you as a continent. We want Nyapako to succeed. You are our representatives, so you are the best of us.
Thank you.
And
Thank you.
yes, and so
It was good. It was good being on this platform. And on behalf of all the members of NEPACO and also the Gambian Parliament, we are saying a very big thank you to you and your entire team for having me to talk on very important issues surrounding health in Africa. And together
thank you. Yes. Together we can. So today's conversation made one thing clear, that the future of Africa, particularly with regards to health, would not be built by one group, not by parliamentarians, not by ministers of health and ministries, not by researchers, funders, regulators, patients or communities alone. It's going to be built by bringing these different groups and these different forces together. And these forces should meet when it comes to the money, the evidence, the regulations and laws, implementation within the communities, building trust as well as accountability. Nyapako matters because it brings parliamentarians into that meeting point. And for us as ACRN, the message is equally clear. If Africa wants resilient health systems, pharmaceutical and health sovereignty and credibility, better health decisions, then clinical research must be part of that architecture and not an afterthought. This has been another episode of the ACRN Health Podcast. Until the next time.